Next, the meds that are becoming very popular, causing a shortage in the market: Ritalin, Focalin, Adderall, Excedrin, Vyvanse, um, and some others that are used for sort of similar indications like modafinil, armodafinil, and Vakix. So these are, I would kind of put them into two categories. So on the top, you have we have methylphenidate derivatives and amphetamine derivatives. These are the stimulants used for ADHD mainly, and some other indications. I'm sure you're familiar with the names like Ritalin and Adderall and Vyvanse. So they mainly inhibit dopamine and norepinephrine reuptake. So they increase dopamine and norepinephrine in the prefrontal cortex especially. And that's how they increase attention and alertness, and they decrease impulsivity. So they help our prefrontal cortex, which is a region of brain which is very important for behavioral, for inhibition, executive function, information processing. They show their impact in the prefrontal cortex. There are other meds that are in this group of stimulants or sympathomimetics that are not used in ADHD, but are used to increase alertness, like modafinil. It's a medication that is used in narcolepsy, and it works on dopamine pathways and glutamate pathways mainly. It promotes wakefulness, and there is a lower abuse risk compared to stimulants. There is Sunosi and Vakix. These two medications also have different mechanisms of actions. They generally basically promote wakefulness. And that's why they're used in narcolepsy or daytime sleepiness, basically. So these medications, as we mentioned, are approved for ADHD, narcolepsy, binge eating disorders, because stimulants, especially amphetamines, decrease appetite. And they're used for shift work sleep disorder to help with daytime sleepiness, basically. Off-label, occasionally we prescribe stimulants in treatment-resistant depression, especially if there's a lot of inertia or sleepiness. They are used frequently for cognitive enhancement in TBI. Usually neurosurgeons prescribe them. They're used for fatigue in multiple sclerosis or chronic fatigue syndrome, CFS. They get prescribed for excessive sleepiness in Parkinson, and also if someone has daytime sleepiness or hypersomnia of no apparent reason, then these medications, either modafinil or the stimulants, can be used for that purpose. Considerations: they usually show their impact in less than an hour. Obviously, they're helpful with low energy, sleepiness, attention, and concentration, and also to decrease appetite. Side effects: side effects usually show up in a matter of like minutes, immediately to hours, depending on the side effect. So insomnia, nervousness, irritability, weight loss, tachycardia, increased blood pressure, a lot of activation, basically. Stomach upset, headache, rebound, fatigue, or crash after the medications wear off, right? And there's a risk of tolerance and misuse. And in terms of workup, usually we need to check the vital signs periodically. And if there's a history of cardiac problems in the family, we may refer them to cardiologists, and in some cases, they get further cardiac imaging to make sure that patients are safe for these medications.